This morning we will look at one of these diseases, and former Deputy Health Minister and Surgeon Dr. Edwin Muguti joins us to give us more insight into bilharzia. Good morning, Dr. Muguti. Thank you for joining us.
Good morning. Thank you for inviting me, and Happy New Year to you and all.
Thank you very much. Now, what exactly is bilharzia?
Bilharzia is an infection caused by a waterborne worm, which we call a helminth. That basically three main organisms: Schistosoma hematobium, Schistosoma japonicum, and Schistosoma mansoni. Hematobium and mansoni are the ones which are commonly found in Zimbabwe. The most common one is the Schistosoma hematobium. The other one is not found here; it's found in South America. Mm-hmm. So it's a worm which infests our urinary system, mainly in the bladder and the lower urinary tract, and also in the large bowel. So it's a waterborne disease, which is quite common, especially during the rainy season. Mm-hmm. Yeah.
And what are the main ways in which this disease is contracted?
Basically, as part of its life cycle, we have a stage which is where the organism is transmitted from the snails, which are found in stagnant water. And if people expose themselves to stagnant water, they can actually have these worms penetrating through the skin and enter the bloodstream. Then they complete part of the life cycle of the condition. So the worms normally lodge in the liver and other parts of the gastrointestinal system. And then that's where they start causing symptoms. They also enter the urinary system, causing the most important symptom that most of us are aware of is passage of blood in the urine, especially at the end of the urinary stream. But before that, during the early phase of infestation, one can have a fever, a mild fever, which we call Katayama syndrome or Katayama fever, which is a warning sign that one has actually been infested with schistosomes. Mm-hmm. Yes.
And how is this disease diagnosed?
Well, we diagnose it mainly through screening when somebody presents with symptoms like the passage of blood in the urine. We test the urine and we're able to look at that. We can see organisms, the eggs, under a microscope. Mm-hmm. So if it's the hematobium type, we diagnose it through the urine, and the mansoni type, we diagnose through looking at the stool under a microscope. We're able to identify eggs, which confirm the diagnosis.
Mm-hmm. And what are the treatment options that are
and they kill the organisms and one is cured. But there is a risk of reinfestation if one is exposed to the risk of playing in stagnant water, where those who go fishing and like to stand in the middle of the river, and they are also at risk, yes. So if one is in that habit, they should wear boots or some other effective means of preventing contact with stagnant water.
Mm-hmm. Yeah. And now, what are in the extreme cases of the development of the diseases of